Hello, my name is Dr. Michael Mack. I'm one of the residents here at the University of Calgary, here to explain to you VRT-C, posterior hyaloid detachment, posterior hyaloid level 4. In this particular level, you do not have any triamcinolone to help you navigate your detachment of the posterior hyaloid, but as you can tell in the video, there are still a lot of cues that you can use in order to tell whether you have detached the hyaloid face. So here a PVD has been induced. Again, I try not to pull too far into the periphery in concern of possibly inducing a retinal tear. And instead I pull segmentally some sections of the hyaloid off before cutting it and creating a bit more space. So here I can tell where the edge of the hyaloid face is. I pull a bit more if I turn off the cutting mode, and then I just, when I'm ready to cut, then I turn on the cutting mode back on and proceed to cut the rest of the vitreous close to that of the ora serrata. So again, here, just using aspiration mode, just pulling a little bit, not pulling too much, and then cutting that face, pulling again, cutting, and then repeat. So that way there you're able to get a nice shave close to that of the vitreous space. As I mentioned in my previous video, you don't want to try to shave close to the ora serrata. It won't necessarily give you more points, at least on this simulation, and it doesn't necessarily reflect in real life where you can use your light pipe to sclerodepress or have an assistant to depress for you while you try your best to shave as close as possible. Chandelier lighting is also an option in real life that's not here in this particular case. So again, try to be mindful of the posterior capsule. Here I am reaching across. I do know where the limits are, and so but in many different times I have touched the posterior capsule and lowered my score significantly. But you want to try to tilt the eye if you can. That way you're able to cut more of the vitreous out. Again, trying to pull, and then get more of the vitreous and cut more. Like I've mentioned in the previous video, the area underneath the light pipe is the hardest. Try to raise your light pipe a little bit more anteriorly so that your cutter has space underneath, and also try to be as close as possible to the ora serrata. I know it's hard because sometimes the machine will detect that as you coming out of the eye of the light pipe and your vision will go black, but like just what happened right there, but you do want to be able to visualize what you're cutting underneath that section. So pulling a little bit more vitreous, and then I'm just trying to make it even on how much of the vitreous skirt I've left. So we scored 96 on that attempt. Thank you very much for watching. Please like and subscribe for more.